foam rolling for your ankle. So the muscles of the ankle you want to think of are the back, the sides, and the front, and you want to be able to foam roll all of those. So when you're rehabbing an injured ankle, I would start with one at a time and focusing on the injured one so that you have control with the other leg. As you get stronger, you certainly can do both at the same time and be more efficient. So with that, I would start right at the knee, raising that up, and so you're only doing a couple inches at a time, and you're nice and easily going over those muscles, finding the tight spots and rolling them out. As that lasts for a few seconds, then you're going to go lower down, and again, a couple inches, rolling them out back and forth. You continue to do that all the way through. As this is easy to do and it's very comfortable to do, you can always overlap your one leg on the other leg, and that adds a lot more pressure and that feels a lot more effective. And so you certainly want to progress to that quickly, especially if it's an injury that you're dealing with in the middle of the ankle, and this is perfectly fine but tight. But a lot of times you're going to find that the calf is directly related to the ankle, and you really want to get in here and spend time regularly foam rolling your calf. So as you go all the way down to the heel, you want to keep working even on those Achilles tendons, and then you're rolling slightly out to the side, still getting the middle, and then internal too. So that's an easy thing to do. Then you can go to the side of your leg. Not an easy thing to do. So you awkwardly but comfortably, and make sure that you're secure, you're just going to foam roll the side of your leg. So you're going back and forth. Again, you can go small, just a few inches at a time, getting some pressure here. If there's no pressure and it's easy to do, you can always add your own pressure. Really find some spots that are tight. As you continue to go down, getting that middle part of the leg. Of course, when you raise your bottom up, you're able to put more pressure into that leg, and then all the way down to the ankle. There's less muscle there, but those tendons really benefit from getting some foam roll time. So then, as they go all the way around, you want to do the front of the shin. I'm going to do the shin facing the camera so that you can see easier. But here, you're not trying to foam roll the bone. You're trying to foam roll the tibialis anterior, and that's just lateral to the bone, so you want to do more of the outside right in here. So again, starting closer to the knee, that you're doing a couple inches at a time, filling those tight spots, and that feels much more effective than even the calves. And you can really get some pressure in there, going all the way down to that ankle. And so you want to make sure you're very thorough, getting the whole the whole front of your shin. Once you're done with that, now we're going to, again, awkwardly get into here. So you don't ever want to cause pain, but you certainly want to be able to get the foam roller into those areas to break up adhesions, to demand blood flow, and to make it feel much better. So hopefully this isn't causing any pain, and if it does, certainly talk to your doctor to find a workaround, and don't keep doing it, but try to find ways to get mobility into all aspects of the muscles that support that ankle. And that way you're going to have a much healthier ankle, whether you're rehabbing it or you're just trying to have better ankles, period, which is great for all of us. Once you've done this whole routine on this leg, certainly go ahead and do that on the other leg. This is foam rolling for your ankle.